Dyslexia, commonly known as word blindness, it's a disease that affects either reading or writing. Different people are affected to different degrees. Some of the problems associated with dyslexia include difficulties in spelling words, reading quickly, writing words, sounding out words, or reading them loudly, and understanding what ones read.
These children with dyslexia have concerns with understanding word sounds, understanding letter sounds, understanding how words rhyme, and they're not able to put words together to be able to read something.
Often these difficulties are first noticed at school. The difficulties varies from people to people, and scientists say that people with dyslexia have a higher percent rates of attention deficit hyperactivity disorder, developmental language disorders, and difficulties with numbers. Dyslexia is believed to be caused by the interaction of genetic and environmental factors. Some cases run in families. Dyslexia that develop due to a traumatic brain injury, stroke, or dementia is sometimes called acquired dyslexia. Dyslexia is diagnosed through a series of tests of memory, vision, spelling, and reading skills. Dyslexia is separate from reading difficulties caused by hearing or vision problems or insufficient teaching or opportunity to learn. The exact cause of dyslexia isn't clear. However, several clues hint at how and why most cases happen. Genetics. Dyslexia is highly genetic and runs in families. A child with one parent with dyslexia has a 30 to 50% chance of inheriting it. Genetic conditions like Down syndrome can also make dyslexia more likely to happen. Differences in brain development and function. If you have dyslexia, you are neurodivergent. That means your brain formed or works differently than expected. Research shows that people with dyslexia have differences in brain structure, function, and chemistry, disruptions in brain development and function. Infections, toxic exposures, and other events can disrupt fetal development and increase the odds of later development of dyslexia. The signs and symptoms of dyslexia include difficulty in spelling simple words, trouble learning the name of letters, difficulties with summarizing stories, difficulty in memorizing, difficulty in reading aloud, trouble in understanding idioms, and difficulty in learning foreign language. Approximately 100 kids have nowhere to report after being driven out of the institutions they were using this year.
100 kids that have this condition of dyslexia do not have a school to attend in January because the Kenya Community Center for Learning that has been taking care of them has been, Senator Bugo is well aware of this particular challenge. They have been driven out of the place that they have been using as a school for the last about 5 years.
Facts are disturbing. Statistics are even more pliable. But perhaps the question we need to ask ourselves, is there enough sensitization by the government and the Ministry of Health on ways of dealing with dyslexia?
Thank you, Honorable Speaker and Honorable Members. I appreciate Senator Medhu for bringing out the issue on dyslexia as one of the disabilities that do exist. Honorable Speaker and Honorable Members, as a ministry, we follow the World Health Organization calendar of celebrations of specific days within the health sector. And dyslexia is yet to be put in the World Health Organization calendar of days to be celebrated. However, we continue to provide and create awareness in the day-to-day activities. But I would also like to say that as a ministry, we would like to take a whole of health approach, that we are not highlighting just one of the disabilities and celebrating or creating awareness around it, but rather looking at the whole area of how do we mainstream disability into the health sector and the health services.
Dyslexia is uncommon overall but widespread enough to be well known. Experts estimate it affects about 7% of people globally, and it affects people equally regardless of sex and race. Currently, no medications to treat dyslexia. Instead, medics advise educational interventions, can teach effective new ways to learn and read. Medics explain that testing for dyslexia should look at decoding. That includes reading unfamiliar words by sounding them out, oral language skills, reading fluency and reading comprehension, spelling, vocabulary, and word recognition.
So there's nothing to worry. If you see any of these signs, if parents notice that their child has these concerns, address it with the special educator or a psychologist and seek help immediately.
Former Health CS Susan Nakuminsha had last year assured the country that her ministry is already down to work and is working tirelessly to sensitize the public on dyslexia. She is appealing to the government to expedite the process of setting up institutions to assist those kids with dyslexia. Whether the government will expedite the process of putting up those institutions as recommended by WHO is a matter of wait and see. Kagunda Kelvin for Tonight Edition.